Now for treatment of shoulder pain from bursitis, tendinitis, arthritis, or even frozen shoulder, place one pad at the front of the shoulder, the second pad at the back of the shoulder. Treat this area for about 20 minutes, and then place one pad on the side of the shoulder and on the top of the shoulder as well for another 20 minutes at least. Now for treating elbow pain relating to tendinitis of your forearm muscle, like tennis elbow, find the tender spot, place one pad directly over the tender spot, place a second pad just about a couple inches below on the same muscle group. For treating elbow pain on the inside of the elbow, like golfer's elbow, again, find the tender spot, place one pad directly over the tender spot, and place a second pad about a couple inches below along the same muscle group. Now to treat wrist pain relating to arthritis, carpal tunnel syndrome, or tenosynovitis, simply place one pad on one side of the wrist and the second pad on the other side to sandwich the wrist. Now for those of you who suffer with repetitive strain injuries, where you're getting discomfort, numbness, pain, tingling, or even weakness sensation right into your fingers, I suggest after you treat your wrist that you treat your forearm muscles by placing the pads here to relax the forearm muscles, and also to treat your neck and your upper back. What this will do is it relax the neck and upper back muscles, relax the forearm muscles, but more importantly, it will stimulate the nerve and blood circulation from your neck all the way down through your forearm, through your wrist, and into your fingers for maximum recovery. Now, to treat your hands for poor circulation or for pain or any inflammation due to arthritis, you simply put one pad on one side of the joint and the second pad on the other side of that joint that's painful to sandwich it. Now, one note here, make sure the two pads are not touching each other so that the stimulation will go through the painful joint instead of directly between the pads. Now, if you do suffer with poor circulation in your hands, you should be treating your hands, your wrist, your forearm muscles, also your neck and upper shoulders to relax the muscles in those areas and to promote blood and nerve circulation from your neck to flow down through your arms and right down into your fingers. For treatment of lower back pain and stiffness of the lower back from overstrained back muscles, from arthritis of the spine, or even from herniated disc, place the pads on both sides of the spine, just above the belt level. Treat this area initially for about 20 minutes. After that, you can always move the pads to target any area of your lower back that is giving you pain or stiffness. Now, for those of you who have pain or numbness that radiates into your hip, leave one pad on the lower back and the second pad right over the buttock area. And for those of you who suffer with sciatic pain, where you're having pain, numbness, tingling, even burning sensations that can run down your leg, right down to your foot, I suggest after you treat your lower back, leave one pad on the buttock and just move the second pad to any area of your leg that is giving you trouble. So you can move it to the back of the knee, to the back of the calf, and back of the ankle, and even onto the bottom of the foot. Now, when you're treating the lower back, I suggest you do it in a sitting position and always sit in a chair with a back support so that the pads will be pressed tight against your skin for perfect conduction. Please have a seat. Treating your back this way will ensure that you get fast, effective relief. Now for treatment of hip pain or stiffness from overused muscles, from bursitis, arthritis, or even those of you who had hip replacement, make sure you use this device to loosen up the muscle and to break up the scar tissue while improving the circulation. Now place one pad at the back of the hip, place a second one in the front of the hip. Treat those two areas for 20 minutes or more if you need to, and then place one pad above the hip and the second one below the hip and treat that area for another 20 minutes. Now to treat your hip flexor strain or groin pain, place one pad right over the groin line, place a second pad just below that area, treat this area for 20 minutes, and then after that leave one pad on the groin line and move the second pad to the area just above the groin line. Now, the correct position for treating groin pain is to lie on your back with your knees and your hips bent. Go ahead, lie down, please. By bending your hip, you're going to make sure the hip flexors are nice and relaxed during the treatment. Now, to treat pain on the inside of the thigh or straining of the adductor muscles, place one pad here and a second pad just above the knee to relax the adductor muscles. Now, to treat your quadricep or your thigh muscles, just place both pads over the same group of muscle. You can do on the outside, you can do in the middle, or more on the inside. Whichever muscle is giving you trouble, you just place both pads over the same muscle group. Now some of you may have trouble with the iliotibial band. Again, just place both pads over the same area to ensure proper results.